Legalized cannabis is quite controversial in this state, which probably most of the people in this room know. I feel pretty strongly about this issue because people are getting marijuana off the street. You don't know what you're getting. Cannabis is not a gateway drug. And indeed, the idea of being able to control, you know what you're getting, is sort of like we've been with alcohol. During Prohibition, God knows what you got during Prohibition. You were getting, I went to school in West Virginia, and you got moonshine, and sometimes that moonshine killed. So I don't have to get moonshine anymore. I can go to my local alcohol store and have a bottle of wine or a bottle of liquor, and I know what I'm getting. The same is true with legalized cannabis. So we wanted to have some discussion from some people who are involved in the legalization of cannabis in the state and open this up for some questions because we know it's controversial. A very special guest for us is the former Senator, Dr. Jen Metzger, who is on the Cannabis Control Board. And so she's working on that board to set the regulations. They're not totally set, so there's some things she won't be able to answer, but she can, field your questions. The other person is Gillian Schauer, who is the Executive Director of the Cannabis Regulators Association nationally. And she's been consulting with the Cannabis Control Board. And Gillian's going to be kicking this off. And I want to thank both of them for taking the time to come on. And Gillian, if you just start speaking, you'll show up on the screen.
Great, and I'm going to share some slides. Thank you so much. It's wonderful to be with you all. I'm here in Seattle, so across the coast. I put together a couple slides because I'm going to present some data, and I think it can be helpful to look at the data directly. I want to make it clear that I might make some comments and they're my own. They don't represent any official position of OCM or of the Cannabis Regulators Association. So I want to touch on the health effects really briefly. I think there are often some misperceptions about health effects, and as a scientist, I like to try to right those misperceptions. And then I'm going to talk briefly about policies to protect public health and prevention, in particular policies that promote equity, promote consumer safety, and prevent youth access. I am going to talk about licit versus illicit markets and wrap up with some final comments. So I think, as I said, there can be a lot of misperceptions about the health effects of cannabis. And I always like to start with the benefits because I think this is something that makes cannabis very unique from, say, other substances like commercial tobacco. There is science to support a range of benefits from cannabis and cannabinoids. And indeed, many people are using cannabis medically. States may authorize much broader use than what the science supports right now. That doesn't mean that we won't have science that comes to support additional medicinal uses. And there are 4 FDA approved drugs. So I think that's a really important context as addiction and prevention professionals to keep in mind that cannabis does have this medicinal role. There are also, though, potential risks from use of cannabis that I wanted to cover briefly. And I want to cover this because I think we're living in an era where you can find a study to support whatever you want to say about the health effects of cannabis. And so we need to be very careful about looking at the reviews and looking at where there's a consolidation among the science. We're also in a very nascent stage. It's been very difficult to research cannabis in this country and to do research using the products that are available. So most of these things that you see on the screen, we have some information about, but it's correlational. It's not causal. We don't know that using cannabis causes these things. So there are a couple of acute outcomes to be aware of that I'm sure you've talked about in your communities. One is impaired motor vehicle coordination and reaction time that can lead to an increase in motor vehicle crash. This is a small uptick with cannabis. It's a much larger effect when cannabis is combined with alcohol. In high doses, use of cannabis, especially by naive consumers who haven't used cannabis before, can cause acute psychosis or paranoia. That's really the sort of overdose effect for cannabis. You don't see respiratory depression in the way that you would with opioids, but can be very serious and requires public education to make sure that consumers are aware of that potential to overconsume. We know that using cannabis, especially when you're young and in high doses, does change the way the brain develops. We don't understand a whole lot about the long-term effects of that, though. We know that there can be cognitive development or related outcomes, but again, more research is needed to understand the long-term effects. There's some pregnancy-related outcomes. The biggest there is lower birth weight among pregnant individuals that use cannabis. There are a range of mental health outcomes. These get very complicated, but I think the biggest that you all may be more familiar with is using cannabis has been associated with an increased diagnosis of schizophrenia. This is especially true in individuals that already have a predisposition for schizophrenia and in individuals who start using cannabis at an earlier age and use in a higher frequency. There are respiratory and cardiovascular effects that are possible. These are typically from the smoked form of cannabis. There is cannabis use disorder. So people who use cannabis can become dependent or addicted to cannabis. It's much less likely than people who use opioids or alcohol or tobacco. It's usually 1 in 9, 1 in 10 individuals. And then, as was mentioned, cannabis, there's no evidence to suggest that cannabis is a gateway drug in youth, but we do know that for some substances, people who are using cannabis may have more difficulty quitting or stopping use of other substances. So I want to give that for context. I think it's important to understand the science. So cannabis policy has far outpaced what we know about the science. And of course, you all in New York are living this as now an adult use state. I think when we look at policy development, there are a few areas that I believe are important to focus on to protect public health. One is promoting equity. 2 is promoting consumer safety, and 3 is preventing youth access. So very briefly, the emphasis on equity and restorative justice. New York is front and center with this, and your statutes really have this built in. This is 3 things primarily. This is equity in the marketplace, making sure that the profits that come from this market that's being developed are distributed equitably across particularly individuals that may have been subject to past criminalization of cannabis. Expungement and resentencing is very important as well. You can't make something legal and still have people that are paying a price for the past criminalization. Expungement should be automatic and should be easy for people to obtain. And then I think perhaps the most important for addiction professionals and prevention and public health, community reinvestment. And New York has an opportunity to really reinvest a lot of the tax dollars into communities that have been disproportionately impacted by the past criminalization of cannabis. And these funds can have a huge impact on the communities you work with, everything from job placement, mental health or substance use treatment, system navigation services, legal services, reentry services, linkages to medical care, housing, violence prevention, youth development. So I think this is a very important piece of policy to emphasize. In terms of youth prevention and consumer safety, I want to start by talking about some of the youth data. I feel like when I speak with communities, they often ask, well, doesn't youth use skyrocket when legalization happens? These are data nationally, but I want to emphasize that these data have been mirrored in Washington and Colorado, the first 2 states to legalize. These are data from the National Survey on Drug Use and Health, looking at past 30-day use of cannabis. And you can see that young adults have always had the highest prevalence of past month cannabis use, and that prevalence has increased as legalization has happened. So they remain an important community to provide education to. You can see the gray line are adults 26 and older. Legalization has increased use there, but it's still generally fairly low. And the blue line is the line you all probably want to focus on. That's youth 12 to 17. And that line has been very stable throughout policy change. So you might be saying, well, this is past month use. It's more important to look at daily or near daily use. That's where we see some of these negative potential health effects consolidated. There we also see this very stable blue line among youth 12 to 17. We've not broadly seen an uptick in daily or near daily use among youth. You can see there has been an uptick in adults, and again, consumer education is very important to make sure that there's responsible use there. But it looks like a pretty good picture for youth. I want to share, though, some considerations. These are data from Monitoring the Future, which is the National Institute on Drug Abuse database on substance use. You're probably all very familiar with this. This is generally the healthiest population of youth that we've seen in a long time, with a lot of indicators around substance use going down. Past month alcohol use declining, binge drinking declining, cigarette use declining, even use of illicit drugs, while there have been really important focus on overdose overall has declined. There are only 2 areas where we don't see a decline. That's with regard to vaping, which I would argue is not a substance, it's a device where you can consume a lot of different substances, and cannabis use. And so it may be that policies are resulting in something that's a more flatline trend than a declining trend. But I think the moral of the story is the sky has not fallen. There's a reason to be focused on continued education with youth, but we do not see huge upticks. So what variables can you focus on, especially with youth prevention and consumer safety in mind? Who regulates marijuana, making sure that addiction professionals, prevention and public health have a voice in the room with the regulator. What's the tax? We know that the way the tax is set can either incentivize the illicit market or potentially make products so low cost that they're readily available to underage consumers. What's legal? The amount that's legal has implications for what can be diverted into the illicit market, types of products, serving size, potency. Market structure, how people are able to access products, what's allowed to be in the products, and this came into focus with the vaping lung injury outbreak in terms of excipients, additives, solvents that can have some consumer concerns. Product testing, packaging and labeling to make sure consumers are educated and that products are packaged in a way that makes them hard to access by underage individuals. Advertising, this can create a social norm in your communities. The point of sale environment, and I'll just briefly comment here that states have not seen an increase in youth access through legal stores to date. Legal cannabis stores in every other adult use state, and as I understand they will be in New York, are age 21 and older. They are only allowed to sell cannabis. They have required ID checks at the door, and they have a really strong track record of compliance there. And then where people can consume the products. I typically give an hour-long presentation where I dive into each of these, and I don't have time to do that, but want to highlight some of the variables that New York will be considering. Lastly, I want to touch on licit or legal versus illicit or illegal markets. And it may feel overwhelming to think that your community will have legal cannabis and legal cannabis stores. A couple things. What you are experiencing now is legal cannabis without a legal marketplace, and that can be very dangerous for consumers, exactly as was specified. Cannabis is legal, but there's no source to get the regulated products yet. So you're in a bit of a window where you may be seeing some trends in your community that will not hold once stores open. Generally, what we see when stores open is that the legal market can provide access to tested and regulated products. Again, referencing the vaping lung injury outbreak, the products that were implicated there were largely illicit, illegal, unregulated products. So there's a real benefit to having the regulation, the testing, the oversight. As I mentioned, the legal market will be an adult-only sales environment. It will require child-proof packaging, which a lot of illicit products don't have. It will require labeling to educate consumers. There will be the ability to recall products that are implicated in potential consumer safety issues quickly, which you can't do on an illicit market. There will be regulation over ingredients, which again does not exist on an illicit market. And lastly, there are public education opportunities, and hopefully you're all seeing the great campaign Cannabis Conversations that New York OCM just launched. But I point to all of these as reasons why I think there can be public health protections in having legal markets. So in conclusion, I think cannabis policy is moving much faster than the science, but current science does support medical use, and that's important to keep in mind. Policy variables that matter to public health include those that promote equity, those that promote consumer safety, and those that prevent youth access. Nationally, youth access has not increased as policies legalizing cannabis has changed, but we need to continue to monitor data nationwide and in New York there. And legal markets can offer increased regulation and product safety and can promote consumer and public education. Products on the illegal market are not regulated, are often untested, are not well labeled, and are packaged in ways that can be more accessible to youth. And then finally, in transitioning to Jen, New York State is in the process of drafting rules on many of these policy variables that are important for public health and safety. And I know they value everyone's voice as stakeholders. So I hope Jen will provide some outlets for you all to contribute as stakeholders in your communities. So with that, I will pass it to Jen, and happy to answer questions in a bit.
Wow, Gillian, that was amazing. You got so much in 10 minutes. So, hello, everyone. It's great to be here today. As a former senator representing Catskill and Hudson Valley communities, I know, unfortunately, well, the toll that substance use disorder has been taking on our communities. And I just want to first just thank all of you for all of your tireless work to prevent addiction and improve access to treatment and recovery. I am thrilled to serve on the state's 5-member Cannabis Control Board, which is charged with implementing the Marijuana Regulation and Taxation Act, or MRTA, that Gillian has been referring to. This is a very exciting place to be. I really believe we have this unique and once-in-a-lifetime opportunity to create a new legal industry that's built on the values of public health, equity, restorative justice, and environmental sustainability. I've been adding that one a lot. But it's my hope that elements of what we're doing here can be a model for other states and even for other industries. New York was the 15th state to legalize adult use when the MRTA was signed into law a year ago, and there are now 18 states that have done so. A benefit of not going first is that we're able to see what has worked and what hasn't, and we're creating programs based on lessons learned and on actual data. So let me tell you a little bit about the structure of New York's cannabis program and the work we've done to date. We're the first state to create a consolidated framework to regulate the production and sale of cannabis that brings together under one regulatory roof the 3 different cannabis programs. So that includes the existing medical cannabis program, the existing cannabinoid hemp or CBD program, and the new adult use program that we are developing. The law created the Office of Cannabis Management, which is responsible for day-to-day implementation of the program under the direction of the Cannabis Control Board. And we expect to have probably around 200 employees in this new government agency once the program is fully rolled out. The Cannabis Control Board had its first meeting in October of last year, and we really hit the ground running. Over the last 5 months, we took steps to greatly expand access to and affordability of medical cannabis to better serve those who can benefit from it as a treatment. We've also expanded the cannabinoid hemp program in a way that really supports participation in this market by our small farmers. There are currently about, in case you're curious, about 45 licensed hemp growers in the counties in the Catskill region. The adult use licensing regulations, as Gillian mentioned, we're currently developing them. But in the meantime, we've recently launched a conditional licensing program for cultivation, processing, and retail. And it's called the Seeding Opportunity Initiative. And I want to just briefly kind of review the different pieces of it. First, it gives New York's hemp farmers the opportunity to diversify into adult use cannabis. This is really kind of a first in the nation program in putting farmers first in cultivation licensing. That may sound strange, but in some other states, it's been companies, not farmers, and it's been cultivated in windowless warehouses instead of on farms. So that's the cultivation side. On the retail side, sun-grown New York cannabis products are going to be sold in dispensaries under a conditional retail licensing program that is only open to applicants that have been justice involved. In other words, they've had a prior cannabis-related conviction or have had an immediate family member who has been justice involved. As Gillian mentioned, a main goal of the MRTA, of the law we passed, is to repair the harms of cannabis prohibition. And we know from the data, white folks and Black folks use cannabis to more or less the same degree. But if you're African-American, you've been nearly 4 times as likely to be arrested for a cannabis-related offense. And these convictions can have an enormous impact on your life and the lives of your family, affecting employment opportunities, education opportunities, your ability to get a loan or rent an apartment. So this law really seeks to give opportunities to those who have been disproportionately harmed by its prior illegality. The state is also supporting these conditional licenses in the seeding for opportunity program with dispensary space at around 100 to 150 locations across the state. What we've learned from other states that have tried unsuccessfully to prioritize opportunities for equity applicants is that the lack of access to capital has been an insurmountable barrier. So we're trying to address this from the start, and we expect these first wave of dispensaries in this conditional licensing program to open their doors this fall. So just to be clear, this is just the conditional program, licensing program. This is not the full adult use program that we're rolling out. We hope to have the regulatory framework in place to begin licensing under the full program before the end of the year. And when that program does roll out, there are going to be 9 different types of licenses people can apply for: cultivation, processing, manufacture, delivery, micro business licenses, cooperative licenses, and others. The intent of the law is to create an ecosystem of mostly small and mid-sized businesses, not a market dominated by giant interstate cannabis companies like we've seen in some other states. The law also sets a goal of providing half of all licenses to equity applicants. And in addition to those harmed by prohibition, this also includes distressed farmers, women and minority-owned businesses, and service-disabled veteran-owned businesses. So those are the different categories of equity applicants that will get priority licensing. So that's where we are now in the rolling out of that of this program. I just want to emphasize that there continues to be a lot of stigma and misinformation around cannabis. It's important to keep in mind, as the point that Gillian was making. It's being consumed in communities everywhere. Anyone who wants to get it can probably get it, but it's an illicit market. It's unregulated, it's untaxed. And what we're doing through regulation and licensing is creating a safe, highly regulated legal market that also has the benefit of generating tax revenue that's reinvested in our communities. Businesses are going to have to meet strict testing standards. They're going to be certified that they're meeting good manufacturing practices. They will be required to meet strict advertising, packaging, and labeling standards. And these businesses are going to be inspected, and compliance with regulations is going to be enforced. So before I close, I just want to say a few words about our work in health education and awareness raising. This week, we broke new ground on New York's very first cannabis public health education campaign. As Gillian mentioned, we're calling it Cannabis Conversations. And through print and broadcast media and social media and other ways of communicating with the public, we're focusing on specific messages about cannabis, about basically keeping it away from young people, not exposing others to secondhand cannabis smoke, about storing cannabis safely out of reach of children and pets, and about the dangers and continued illegality of driving under the influence. So these are like the key messages of this first 3-month campaign. The next phases will reinforce these messages and broaden the campaign to include messages about the equity goals of the program, more on the medical cannabis program, the risks of consuming while pregnant and breastfeeding. And we're also going to be raising awareness about the risks of addiction, how to recognize it, and where to seek help. So we're working closely with the State Office of Addiction Services and Supports, as well as the Department of Health. And that's about all I can squeeze in this amount of time. But I want to thank you. I know it's a lot of information, and happy to take some questions in the remaining time.
Great. Thank you both very much. That was excellent, excellent. They will take some questions. If anybody has a question, if you could come up and use the microphone, that would be great. Come on over. And while you're coming over, I do have a question about, with cannabis being legalized, why are we differentiating still between medical cannabis and cannabis that somebody would just buy for recreational purposes?
I can jump in with a national perspective if Jen wants to then chime in from New York. So I think this varies from state to state. There are some states like my own in Washington where we just have one marketplace. There's not a separate place that patients go. But in talking with patients, many patients do want a separate place to go where there might be a clinician on staff, where there might be some different types of products that they need for their particular condition. And so I think every state is in the process of working with their medical community to figure out what patients want. And we do have a bit of a patchwork across the country in terms of how that looks. And often, you know, even if there's one marketplace like my state in Washington, patients can opt to be on a registry to forego paying taxes on the products. You know, they may have certain stores they can go to talk with somebody about the product medically. So I think there are a lot of patient needs that states need to consider in terms of product, ability to access product, ability to talk with somebody about that product in a medical light. I'll let Jen jump in from the New York vantage.
Yeah, I mean, those reasons that you just outlined are the reasons why we are maintaining and strengthening the medical cannabis program in New York. And, you know, that, you know, ability to speak with a knowledgeable person, pharmacist type of person, and also, you know, we can see, you know, we may be seeing like different kinds of products for different kinds of conditions coming and that sort of thing, but it's a treatment. And actually that was a good point, Gillian, that you also made. You know, the tax is lower for medical cannabis, so it's going to be more affordable as well. But I think there are good reasons to keep it. But of course, there are certainly going to be people that you know, are just going to procure it through the adult use market. And I did want to mention that we are also right now, we're actually, we're releasing for public comment, probably at our meeting next week, revised regulations for home grow for medical patients, but there will also be home grow for the adult use market too when that program rolls out.
Thank you. We have a question.
Hi, I'm Irene Beatty. I'm a peer counselor, Margaretville Opiate Network. Actually, it's going to be two questions. One question on medical marijuana is that what you fail to actually are telling the public too is once you get on medical marijuana, anybody who goes on that, and I know a lot of people who are asking me about it, and they're my age and, you know, times are changing, you cannot, by state law, get any pistol permits. You can't carry one. There's a lot of women out there who does what I do. So they can't do that. That's ended that career for them. You know, they cannot be sheriffs. They cannot get, you know, armed security or anything. So that's New York State. Secondly, with medical marijuana, my concern is there are teenagers now who are still using. As a peer counselor, I see this when I go out. I see this, you know, from teenagers straight up to adults. I also have a seizure condition. It's treated medically. When you start talking about medical marijuana, each person who's got a condition that marijuana, not medically, but marijuana itself, can actually cure things. I have studied this for years because of the condition I have. I cannot get what I need in New York because I cannot get it medically. I understand what you're doing, but I just like to know how much research you have actually done besides medically to actually look into the marijuana stage of this, because it is really a serious thing because you can get addicted to marijuana. I've seen this because I had a son of 16 years old that actually did this, and I actually had to put him into detox because he smoked every half hour a day.
So I think you're raising a good point that actually has come up as well in some of the community meetings in our region that have looked at, are we opting in or opting out? I know at the one in Roxbury, people said, well, it's addictive. Maybe, Gillian, you can speak to what do we know about the addictive capacity of marijuana? Thank you. Good questions.
Yeah, and thanks for sharing your personal experience too. So as I mentioned, cannabis can be addictive, and there is a cannabis use disorder. It is in the DSM-5, and it has many of the same hallmark characteristics as other dependents would, including things like withdrawal and tolerance, which previously, 10, 15 years ago, there was a lot of debate about that. We now have science about that. As I mentioned, the studies to date show that cannabis dependence is less likely to occur than for most other substances. It's usually about 1 in 9 or 1 in 10 individuals, but it's more likely in people who start using cannabis at an earlier age and in people who use cannabis more frequently. And so I think those are two sort of intervention points that we can focus on. Preventing early youth initiation, preventing in youth that are experimenting with cannabis, preventing them from getting to a pattern of use that is very frequent, because that is more likely to lead to dependence. It's also true that consumers who are using cannabis medically can also have dependence. That's absolutely true. And so I think that the burden is on us as a community to educate clinicians as well in how to look for dependence, even if they have a patient using cannabis medically, how to recognize when that becomes problematic and provide interventions. And that's the third prong, is sort of what are the interventions for cannabis? And I think science has a long way to go there. For tobacco control, for example, New York State has a quit line where people can call and they can get help easily. They don't have to go into a doctor. They don't have to, be part of an outpatient treatment setting. So I think there are a lot of opportunities to look at how we provide treatment for cannabis dependence to make it more available for individuals who want it. And there's some really great studies there, some out of Australia, where they've developed a cannabis helpline that's not abstinence only. It focuses on meeting people where they are and giving them the support they need to curtail their use, to modify their use, to stop their use, whatever their goal may be. So happy to share any of those studies, but I think, as I mentioned, we've not been able to conduct nearly the type of research that we need to in this country because of the Schedule I designation that's on cannabis federally. It's very hard for researchers to do the type of research that's needed. So we're going on what we know, and scientists around the world are trying to learn more fast. But I think all of those were good points, and hopefully my response gives you all some touch points in your community to think about dependence.
Great.
Yeah, and I would just add to that the education, the public health education piece of it is so critical, and that's something that we're going to now have a lot more of in New York State. I mean, it's a main thrust of the law that was passed. We're required to have this as part of our program. And also the law requires that 20% of the state revenue generated by cannabis sales is to be invested in education, prevention, and treatment of substance use disorder.
Great, thank you. We have a couple minutes left. I'm going to remind people on Zoom, if you have a question, put it in the chat and we'll get to it. Betsy, come on up.
But yet the law has changed and people are accessing cannabis. How are we keeping this possible dangerous substance out of the hands of children, since we know that they can be impacted at such a young age?
And can I just add to that, thank you, Betsy, that in the town of Roxbury, and I'm speaking for that town, about that town, because I live in that town and I participated in the town board's open hearing on what to do about whether to allow businesses to sell it in the town. And the biggest concern was there's a school there. And how is it going to be that schools weren't going to have access to it? The people would drop gummies on the gummy, whatever they're called, onto the ground, and they pick them up and they might eat them, et cetera. So.
Yeah, I think, again, as I mentioned in my talk, New York is in what I view as being one of the more vulnerable periods in legalization. You've legalized, people know it's legal, but you don't yet have these adult-only retail stores where people can access it. And so we do tend to see a bump in the illicit market in that time period when rules and regulations are being made before the markets are available. And it's very sad to hear about the consumption of edibles by kids, passing them out at schools. I would venture to say that's a bit more likely now because of the illicit market. Again, the legal market will have edible products in child-proof packaging. There should be point of sale education. Most states have this about safe storage of edibles, out of sight, locked, out of reach. And there's an opportunity in the legality of cannabis to have more conversations in communities and in families about safe storage, about youth access, about the potential concerns among youth. And I think, New York's public education campaign is the start of that, but one that will grow to include more messages for youth prevention, to include more work in schools, to identify what's coming into schools, to have conversations about it. But the illicit market is probably at what I would say is, venture to say, it's probably a peak for New York right now, because you're on the cusp of opening stores, and that illicit market will decline quickly once there's a legitimate legal place to get safe products that are packaged in a way that hopefully can prevent youth access. And Jen, you have more of the New York perspective, so jump in. I'm giving sort of the national.
Right. I mean, I would just say that, like we're very, highly cognizant of that, this kind of challenging transition time. And, and in part, that's, why we put this conditional licensing program in place, so that we can get started in a regulated market environment while we are making sure, while we're developing the full regulatory framework. We want to make sure it's that balance. We have to make sure that we get it right and take the time and not rush it. But we also, we don't want to delay too long. So, yeah,
Great.
this year.
Well, I want to thank both